that when symptoms appear in patients with severe aortic stenosis, intervention is indicated according to current European and American guidelines. But neither of these guidelines specify the type of symptoms which should be considered when the intervention should be done. Hello, my name is Mario García Gómez. I'm a cardiologist in University Hospital of Valladolid, and I'm doing a research and fellowship in interventional cardiology. And I'm going to talk about our paper called Evolution and Prognostic Significance of Patient-Reported Symptoms After Intervention with Severe Aortic Stenosis. This is a paper that is scheduled for publication at Mayo Clinic Proceedings. So we have performed a retrospective analysis parting from the question that do all symptoms disappear when patients with severe aortic stenosis undergone aortic valve replacement? We have included a total of 451 patients with isolated symptomatic aortic stenosis, which is defined by the absence of moderate or severe aortic regurgitation, the absence of severe or moderate mitral regurgitation, and the absence of significant coronary artery disease. At baseline, the most frequent symptom was dyspnea, followed by angina and syncope, and about 40% of the patients had admissions to the hospital because of heart failure. Most of the patients undergone surgical aortic valve replacement, and 37% of the patients undergone transcatheter aortic valve implantation. After a median follow-up of 56 months, most of the patients remained symptomatic after the intervention, which is a very important finding. And only 42% of the patients had no symptoms after intervention. Between the symptomatic patients with recurrent symptoms after intervention, the most important symptom was once again dyspnea, followed by syncope, and the less frequent symptom was angina. We performed a multivariate analysis to know which predictors were independently associated with the persistence of symptoms. In the multivariate analysis, we find that older age, higher body mass index, previous heart failure, and chronic obstructive pulmonary disease were all associated with the persistence of symptoms. This is a very important finding because this highlights the question that not all symptoms in patients with severe aortic stenosis are related to the valve disease, but maybe they might be associated with other conditions, such as frailty, physical deconditioning, respiratory airway obstruction, or the most important, with irreversible ventricular remodeling. This is very important because it might raise the question that maybe some patients should undergo the intervention in an earlier phase. In the analysis, we studied the survival prognosis of our patients, and we found that the most important predictors of all-cause mortality were once again older age, chronic obstructive pulmonary disease, and body mass index. The most surprising finding for our study is that persistence of symptoms after intervention were associated with all-cause mortality, but persistence of symptoms were not associated with cardiovascular mortality. This is very important because once again, this highlights and reinforces that the idea that the symptoms in patients with aortic stenosis are not only associated with the valve disease, but with other conditions as commented before. Finally, we can say that the key messages of our article is that many patients remained symptomatic after aortic valve replacement, surgical or transcatheter aortic valve implantation. The most frequent symptoms that persist after intervention are dyspnea on effort and syncope at rest, highlighting the idea that other conditions should be ruled out, such as orthostatic syncope, respiratory disease, obesity, etc. And finally, the persistence of symptoms is associated with all-cause mortality, but not with cardiovascular mortality. So we invite all our readers to check the article because we think it's very important when we are facing patients with aortic stenosis, and it might help to select more appropriately patients that should undergo aortic valve replacement, and maybe to study deeper patients who need other proofs, and maybe consider that the aortic valve replacement should be futile. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.